Back to the Road to Great Health podcast, where we discuss natural solutions to today's worst health problems. I'm Dr. Kevin Lenderman from South Louisiana, and I'm joined as always by the one and only Dr. Rob DiMartino out of Las Vegas. What's up, Doc?
It's no wonder I like doing these seminars. You pump me up so much.
Pump you up, man. Yeah. Very
I
good.
like it.
We're on number 30 today.
We're into our 30s now. We're
We're
good.
into our 30s. So, guys, we've got a very important subject matter for today's podcast, and we are going to take on Graves' disease. Now, for those of you that don't know, Graves' disease is classified as an autoimmune disease of the thyroid, and kind of like Hashimoto's. Hashimoto's is an autoimmune disease of the thyroid that makes it go low. Graves is typically an autoimmune disease of the thyroid that makes it go hyper, it makes it go high. And as Dr. Rob is probably going to explain to you guys today, it's actually way more than that. It's what's going on with this. But Doc, would you say that Graves is actually more dangerous in many ways than Hashimoto's?
Yeah, for sure. It's
Yeah,
everyone always asks me to because everyone talks about Hashimoto's because it's just way more common. But then all the
right.
poor Graves people are like, what about me? Like nobody talks about Graves, and it's an important process. And you're right, it is more dangerous because it will put more strain on the heart. That's the concern, right? That's why the doctors panic, because most of the people who have Graves can tell you that one of the first things that they feel is they'll feel those palpitations, they'll feel that heart flutter, because it makes your thyroid hormone works with so many different parts of your body. It definitely works with your cardiovascular system, and we don't want to put extra stress on that system if we don't have to. So I understand that the doctor's perspective of we don't want your heart to work that hard and get overstimulated, so we're going to give you the meds to try to bring your thyroid levels down, but none of that addresses all of the underlying things that we'll talk about today of, okay, why is your thyroid hyper? Why would it do that? What's it trying to do versus just saying, okay, well, let's just shut it down and stop the function. But I understand that perspective of it because, yes, we don't want the heart to work really hard. We don't want the eyes to bulge, right? We don't want pressure behind the eyes that can create all kinds of damage. So it's not a good problem to have, but we have to get to the source of what's causing it.
Yeah, so if you guys will think of your thyroid like the accelerator pedal on your car, and in Graves' disease, your pedal is stuck to the floor. Everything speeds up, your heart rate, all of that. You could get anxiety like feelings, you could get the bulging in the eyes. Which, interesting enough, Doc, I got my first patient in last month that only has bulging in one of her eyes.
Oh, interesting. Yeah, because
Yeah,
usually you end up with it on both sides, but
it's almost
that can be
always
really
both.
prop. You could really that can be really problematic. I've seen that cause some hellacious damage over the course of people have it unchecked for years, and it can create
Yeah.
all kinds of problems, headaches, and pressure in that area is not good.
Yeah. Now, typically in the medical field, they're going to radiate the thyroid to kill it, or take it out. And typically, if they radiate it, then we're dealing with two problems. We have the patient's been radiated, and at the same time, they still have what was causing the Graves' disease. And so, there's not a good solution in the medical field to really figure this out.
No, there's not because again, it's really misunderstood. And they don't talk about the causation of it. They just look solely at the thyroid and they're like, oh, okay, well, it's overacting. They don't ask why it's overacting or what could possibly cause that. So they just say, well, this part is overacting. And it's really going to come down to, with autoimmune stuff, especially in all forms, it's going to come down to which camp do you believe? Do you believe that the body just inherently has made a mistake and started doing things completely incorrectly for no reason whatsoever? And that's when we say, I don't know what causes this, right? That's also why that's the medical belief, the centralized medicine is that we don't know what's causing this and it's just doing this because it's weird. Or are you in the other camp where it's like, okay, there's a reason that this happens, there's actually science that we can point out that we'll go over today. It says, okay, this is exactly what happens, and this is why it happens. But really, it's going to come down to which one of those two sides you believe, right? Because everyone
Right.
believes that we don't know what causes this. And the only thing we can do is that because it's made a mistake, we medicate it to low, we radiate it till it dies, or we cut it out in totality where it doesn't work. But you're going to be surprised today, as we go through all this stuff, there's a tremendous, we know exactly why this happens. right? Now, that's not to say that there's nothing in medical that can fix that part, right? That's why they don't talk about it, right? Because all the things that make this happen, they don't have any solutions for, so they just jump to the stuff that they have solutions for. But it's misunderstood. But the only misunderstanding is because we haven't done a good job as doctors expressing it to people. It's not that the science doesn't know. That's the
Right.
key.
Yeah, I was telling a patient this morning that had just all kinds of health problems going on. Like, look, you don't have this because you're unlucky, right? Like your body's not stupid and making seven mistakes at one time, and you're just doomed to a life of failure because you drew the short straw or because you got unlucky. And then of course the response was, well, what if it's genetic? Well, why'd you get it at 42 and not 32? Like, that doesn't make sense either. Your genes didn't change over the last 10 years. And then I started showing her everything that kind of damaged her body. She was living in mold. She had, some childhood trauma that wasn't addressed. I mean, there was a multitude of things. She got several infections. And when we laid all of this out, I mean, she started crying, really, because she finally realized, like, I'm not just doomed to live like this because I drew the short straw.
Yeah, you did the work to find all of the issues that we've made how many podcasts on talking about all the roles that they play,
Right.
right? We did a
Right.
podcast on Mo, we did a podcast on childhood trauma, right? They all play, and it's never this one arch villain that causes it all. It's all of these little things that accumulate over the course of time that it's just a matter of what the body can adapt to or not.
It goes back to my bucket analogy I sent you the other day. Think
Fucking
of your
analogy, I
health
like
like
that.
a
The fucking
bucket.
analogy.
Yeah. Think of your health like a bucket, and everything you're exposed to or you have happened to you is a few drops in the bucket. And when your bucket overflows, you get sick. Now, everybody's bucket fills for a different reason, and everybody has a different size bucket. But the idea is, what is filling your bucket, causing it to spill over so that you end up with a disease? And that's what all of these podcasts have been about, really, since we very, very first started. So, Doc, what are some of the things that you use to determine Graves specifically?
So you have to run specific testings on thyroid, right? So the typical thing that you're going to see that's the big key is when you run that TSH marker, which again, a lot of people don't run, a lot of doctors will run it too. It'll look really low. Now, again, sometimes that's confusing because in Graves' disease, you're saying, okay, my thyroid's overactive, but then the TSH marker is very low, right? And it's the opposite in Hashimoto's or low thyroid. So, but then you have to piece it back to, okay, well, which steps are making it high, right? So the TSH will be low, but then typically the T4 will be high, or then the T3 will be high, and then the thyroid output will be high because Graves is a bit of an unusual autoimmune disease because unlike Hashimoto's, where the direct thyroid tissue is getting damaged itself, it's actually the immune system is turning on for a problem typically elsewhere in the body that's happening. And instead of the immune system turning on and calming the immune and basically activating, it stimulates the thyroid exactly the same way TSH does. So TSH is thyroid stimulating hormone. So that's why that number is so low. But we have some sort of cellular damage someplace else. The thyroid will pick up its output in order to help solve that problem. And then your immune system stimulates your thyroid to make the more thyroid hormone to help solve that third party problem. So when we stop your thyroid from doing that, then all of a sudden the third party problem gets significantly worse. But we're just looking at, well, your thyroid's overactive. But it's not the damage to the tissue. It's not the damage to the thyroid tissue that's causing that. It's the actual immune system, very specific cells in your immune system called B cells. B cells will turn on thyroid production. Now, of course, now the question is, why does it do that? And which we'll get to. But one other thing I think is really important is it is not uncommon, and it happens quite a bit, that people will get both. You'll get Hashimoto's and Graves, right? So the thyroid itself is taking damage, but in Graves, we have to run different antibodies. In Hashimoto's, we run TPO antibodies and TGB antibodies. Those are the two typical antibodies for Hashimoto's. For Graves, we have to run TSI, thyroid stimulating immunoglobulin. We want to see if the immune system is working exactly like TSH and causing your thyroid to overproduce. And if that's happening, then our job is to become, okay, where else in the system is this happening that you need more mitochondrial thyroid output in order to solve the problem?
Yeah, so guys, when Dr. Rob is talking about all these thyroid steps, you have to understand that there are several steps. There's like 12 steps to make usable thyroid hormone. It's like building a car, like an assembly line. One person puts the wheels on, one person puts the windshield. There are several steps to make usable thyroid hormone, and typically they test one, maybe two. And the reason our thyroid panel is like 12 markers big is so that we can evaluate each one of these little processes and each one of these little steps to see where it's actually dysfunctional. And then we have to compare things like, he was talking about low TSH. Well, if somebody's on Synthroid, they can have low TSH too. So that's why we have to really dig deep to get to these underlying steps to see what's happening. And I'll tell you this, that takes more than a 5 or 7 minute office visit to figure this stuff out. That's why
Sure
Dr.
does.
Rob and I, we don't do 5 or 7 minute office visits. I mean, we spend hours figuring this out for our patients. But knowing what to look for and what is breaking down is why his program is just such a phenomenal program, because we're looking at causation and what steps are malfunctioning.
Yeah, and we're not just going to be lazy and blame the thyroid for just not working for no reason, right? Like
Yeah.
it's the most lame excuse in the history of the world. Like, oh, your thyroid just decided to go crazy, and we don't know why, and it didn't do it for any reasons, despite all the scientific research over here that says we know exactly why it does it, and we know that the B cells stimulate it. But the
Right.
thyroid is such an interesting organ because in order to make thyroid hormone, your thyroid needs to make a tremendous amount of hydrogen peroxide. So your thyroid has to basically live almost in a situation of just being engulfed in bleach all the time. And that's very oxidative, it's very inflammatory, it's very damaging, right? So when your thyroid, so everyone always asks, like, why is there so much thyroid problems? Like, why is there so much thyroid, disease, or why is there so much, hypothyroidism or hyperthyroidism or Hashimoto's or Graves'? Understand that situation of where your thyroid cells have to live in that kind of basically under duress all the time, right? It's easy for that to get out of control. That has to be really tightly regulated. It's easy for that to get out of control and get damaged. So like in Hashimoto's, we see the hydrogen peroxide has kind of gone out of control, damaging the cells in the thyroid. And which parts of your cells, again, make hydrogen peroxide? Well, shockingly, it's your mitochondria. Now, again, you Google all this, right? It comes up, oh, it's hydrogen peroxide, all these things, and they'll admit that. But I'm like, but where does hydrogen peroxide come from? So it's the mitochondria. So again, even forgetting the science and forgetting the research, doesn't logic dictate if we're blaming hydrogen peroxide for the damage that happens to the thyroid, which is correct, doesn't it make sense to ask the next question? Say, well, where does the hydrogen peroxide come from? And if it comes from the mitochondria, then doesn't it make sense to logically deduce that if the mitochondria are messed up, it's going to cause too much hydrogen peroxide and it's going to damage the thyroid and create something like Hashimoto's or Graves' in our case scenario? So I love how they don't like work it all the way back, right? Even they'll
Yeah.
make medications to handle hydrogen peroxide. They make medications to handle the inflammatory markers that the autoimmunes make, but all of those inflammatory markers come from the mitochondria. So almost it's like admitting it's coming from there. They just never actually say those words.
Yeah.
So in
That
the
would make
case
way
of
too much
Graves',
sense.
it would make way too much sense. And God forbid people could actually go online and Google and find all of this out versus where.
Right.
But if you don't ask these really specific questions, Google's not just going to like offer
Yeah.
this to you. It'll just say
Yeah.
like, yeah, the cause is unknown and all these different types of things, and the like. So the problem here is if we get mitochondrial damage in a different part of the body, right? Big ticket items, heart, brain, kidney, liver. Those are your four most typical places where you're going to find the third party problem that I alluded to before. Those are the
Yeah.
big places where you're typically going to find the third party problem with your thyroid. Those mitochondria and those cells are going to damage. They're going to send out signals to your immune system saying, hey, help, we're hurt, we're injured, we need to be repaired, we need to get replaced. And the immune system is going to react in kind. If the problem is serious enough, right, and it goes on for a long enough time, your immune system is actually going to make the right call and then tag in backup, which is your thyroid. So those cells that go out to try to help and save those mitochondria, it's going to then stimulate the thyroid, because what does thyroid hormone do? Well, everyone talks about it has to do with metabolism, right? And losing weight, which is a symptom that people will see with it. But the idea of metabolism is where you have to make more energy in the mitochondria, and it causes more mitochondrial biogenesis, which means you make more mitochondria. That's what thyroid hormone does. So if you're losing mitochondria in your heart or your brain or your liver or your kidneys, which are big ticket organs, your immune system is rightly going to say, hey, man, we need more thyroid hormone to go out there and help. Because if we run out of energy in your heart, that's called heart failure, right? Congestive heart failure. That's what that is. So your immune system B cells are going to turn that on, because now this damage has been raging for such a long period of time. It needs extra backup. And now if that problem is not going to get solved, if that mitochondria in the third party keeps damaging, now it's going to actually cause a problem where we don't even have the cells to shut it off. And now you're just stuck in this big old negative loop that the body can't break itself out of. And the thyroid will keep racing to try to help solve the problem. Now, if that makes a tremendous amount of hydrogen peroxide to make all this extra thyroid hormone that's being stimulated by your immune system to make, now it's going to damage the thyroid cells. Now, wow, look, now we've got Graves' and Hashimoto's antibodies, and they're acting like we have no idea where this is coming from. It's just not always as linear as the straight shot of, oh, your thyroid's off, it's got to be your thyroid. I think we talked about this in the last one. The body all works together, right? The body all works together. Like it's this weird perspective of medical that they're like, well, that has nothing to do with that. I actually had a doctor comment on one of my things that they said, silly, your eyes and your skin don't talk. You think they have nothing to do with each other? You think your body's completely has no idea what the other things are doing? And that is terrifying for me, because I'm like, that's the thought process. No wonder they look at the body as so compartmentalized. But you get this really compartmentalized view in Graves. And once you understand the big picture, the solve of it becomes very obvious, right? The solution of why it happens, where you need to look, what you need to do, like the things you pulled apart very well for your patient, that all becomes kind of straightforward versus this, I don't know, it just must have went crazy for some reason.
Yeah. I guarantee you, if you took that guy's arm hair and you ripped it out, his pupils would dilate. Right?
I should have said that. That's such a better thing than what I said too. Oh man, that would have been a way better remark.
Right. Absolutely. Everything in your body is 100% connected. Now, that's just fascinating about that third party problem on big ticket items and how that relates into making this runaway reaction with Graves. And then on top of that, they have additional triggers as well, usually like, emotional stress and the gut connection and all of these other things. And so, this gets complicated, and you really have to work through each thing to figure it out.
Yeah, and I think I, I think part of the issue that comes down here to this is, as doctors and just in general people, we love the stuff that we can quantify, right? The stuff that we can see and taste and touch and smell, right? Like we run a test for this and exactly see the clear picture of all of this. But this concept that I'm explaining, right? B cells stimulating this, that's not something we can directly measure. Like I can't send you off to LabCorp and find that out. That's
Yeah.
something that you and I, as clinicians and experts, hopefully in our field, just have to know. And then once you know that, then you can say, okay, now we can work backwards and figure out some of these things, right? Now, this is what's happening. If you have this diagnosis or these antibodies, you have those TSI thyroid antibodies, that means you're going to have Graves. We know that this is happening. Now we have to look for the pattern of why it's happening. But that first part where they said, well, we don't know why it's happening. No, you just can't test that directly, right? There's no one
Yeah.
test that we can do that's going to give you that answer. You have to run a series of things and know how to interpret that pattern, because you know in your head, okay, that means these B cells are turned on and they're stimulating your thyroid like your TSH, and then your pituitary doesn't do it. So that's why your TSH goes to virtually nothing. So the question then becomes, what problem in the body are the B cells trying to solve? Because if
Yeah.
we can solve that problem, the B cells go away, the thyroid stimulation goes away, and then, oh my goodness, now we have very different looking tests. That's all. I'll
Yeah.
safely say that.
Yeah. Patients do love very simple, like super linear kind of testing, like the blood work. I mean, patients love looking at their blood work because they're so American ingrained that like the blood work tells everything. And it's very common. I'll be doing a consultation with a patient and I'm trying to show them something really important. They're like, well, what does my blood work show? I'm like, you've got 7 more things and more important than what your blood work shows. Like, your
Yeah.
mitochondria are damaged, your energy system is crashed, all these things. And we're so focused as Americans on very linear data. Like your blood work markers this, it should be that. But we are more than a sum of our lab work, and in America a lot of times they don't look at it that way. And Doc, one of the coolest things that I ever thought that I heard you say about this whole thing is, if I were to die right now and they drew my blood and ran it through the lab, it would look fine. They wouldn't know I was dead. The blood work would
Right.
come out perfectly normal. But what's missing? The mitochondria have stopped working. And
Yeah.
so it's
Right.
not all about the blood work, guys.
Now, and like I said, I get it to an extent because most people are very visual, right? We are visual learners, right? That when I show stuff, like I show a lot of graphics and things like that. So people are really visual learners. So we want to visually see something, right? We want to be able to visually see something, visually test something. More so than even the patients worry about that. I get crazy that the doctors are like that because sometimes people will ask me, they're like, "Oh, doc, that's fascinating. What on my blood work shows that?" Nothing. That's just what happens. Like that's what I have to know that happens. What shows me why it's happening is these guys, right? But there is no like one mark where I could say that means that's happening and that's what that says. You have to know these perspectives of it. And to be fair, we talk about it all the time, how much time we spend researching outside of clinical hours, right? Like, it's all that I do basically, right? I have time dedicated that is just built for research time that's scheduled into my life so that I can have to sit down and kind of go over all this sorts of stuff. When we're doing all the lifestyle things, we're out in the sun and talk about all those things. When I'm out there, I'm researching. I mean, that's what that time is spent doing, obviously trying to build your health and understand these things. But the visual aspect of it is, I think, where people say, oh, I want to know that thing directly. And it's like, nope, that's not what it is. So the last Graves patient I sat with, she's like, I have Graves. And I'm like, all right, there's some third party problem. And she said, and so I was explaining what that means. And she goes, well, wait a second. She's like, the last time I was at the doctor, he told me my liver enzymes are sky high. Oh, well, what did he say about that? He said, no, don't worry about it. Well, if your liver enzymes are high, means your liver's damaging, right? And pretty significantly too, right? Because even alcohol, 80% of alcoholics have normal liver enzymes, right? So it takes a lot to damage your liver like that. So you have these liver enzymes that are elevated. That's this classic third party problem because your thyroid definitely backs up your liver. Now that's damaging. Now, does it make sense why your thyroid would be stimulated to go there? And I'm watching her face like, oh my gosh, she's getting it. Like
Yeah.
she's got this now because her eyes are getting bigger and bigger and bigger. She's like, yeah, no, that totally makes sense. Because I asked him, I'm like, well, why are these up? I'm like, don't you care? And they're like, but no, but that's I'm endocrinology. That's a different organ. Like, forget that. That has nothing to do. Again, these two parts don't talk together. So, but it was so clear, and I'm like, man, I don't even have to run labs. Like, I don't even have to really look. Like, here's your issue, right? Like, you told me the answer. It was already there. They just don't look and say, well, those two things have anything to do with each other. So lots of times, even when the labs that people bring, you'll find all kinds of crazy stuff that just kind of gets overlooked, or the patterns of how they make sense together are overlooked.
Yeah. Well, well, Doc, one of the last things that I wanted to talk about today is the increase in Graves cases since that whole 2020 COVID vaccine, that whole era, because
Yeah.
there's new research coming out all the time on the increase in cases after that era. What all do you know about what's happening there and why that is?
Okay, so the big problem that 2020 and the spike protein has created is the spike protein was directly toxic to the inside of the mitochondria and basically what would be analogous to the electrical wiring in your mitochondria, right? So it will fry that internal wire inside your mitochondria and it creates electrical damage. So when we fry that inside wire of the mitochondria, massive damage occurs, massive inflammation occurs. The mitochondria starts signaling to the immune system like wild. And if we really fry the wiring, it is very easy for the components of the mitochondria that get damaged to actually spill outside of the cell. And we talked about this in previous podcasts. When that tissue spills outside, when mitochondrial tissue gets outside of the cell, your immune system reacts to that the same it would react to as a bacteria or a virus. So if we specifically damage the mitochondria in high energy uses places, right? So spike protein likes mitochondria, but it likes mitochondria that generate a lot of power. Well, what is that? Well, that's your brain, that's your heart, that's your liver, that's your kidneys, right? It's all the third party big ticket items that we talked about. So if that spike fries that mitochondria, well, now, okay, what do we need? Well, we need more energy output and we need more mitochondria to be made. Well, what helps with that? Thyroid hormone. So now your immune system, which is reacting to the damage that the spike protein created, now also in its infinite wisdom turns on, those B cells turn on your immune system, and it turns on your, well, on one side, but it turns on your thyroid on the other side to make more thyroid hormone to create the needed thyroid hormone to make more energy and more mitochondria that got fried by your spike proteins. But we look at them as separate problems. And we don't, again, they're not related towards each other, but there's this very clear linear path. And unless that third party problem, unless that spike protein stops frying those mitochondria and we can stop and get those mitochondria healed, the immune system will constantly stay turned on. And if it constantly stays turned on, it's going to constantly keep the thyroid on and we're going to keep the person in graves. Now, does that make their heart work harder? Yes. Does that create inflammation? Yes. Does that create hydrogen peroxide? Yes. Does that create the eye bulging? Yeah, it creates all those things. But it's this very linear line of, okay, this is what the spike protein did. This is what hurt us. This is the ramification of that. Now your immune system gets involved. Your immune system tags in your thyroid for backup. Again, it sometimes I'm like, well, maybe I make it overly simplified. Not that any of this is simple, right? But everyone's like, how is that possible? That it's just that clear. If you go ask what I just asked and you put it in online, it'll tell you, yeah, that's exactly how it goes. Right? But it's not going to offer that as the example.
Yeah. Well, I have to say too, for all of our listeners out there, um, Dr. Rob actually predicted all of these kind of autoimmune increases and all of this in about 2020,
Yeah.
2021, sitting in Vegas,
Yeah.
listening to him go like, it's going to be a mess, guys. And now 6 years later, 5 years later, we're starting to see, that it absolutely is. But with Graves specifically, I want you guys to know that there are ways that you can figure out why this is happening. You might not necessarily have to take your organs out or radiate yourself, for goodness sake. We can figure this out, but it's complicated, and you've got to go to somebody who's willing to spend the time to and do all the necessary tests to sit down and figure this out for you. Doc, any final thoughts?
I mean, the only thing I would say is that a lot of questions I get are people like, well, what doctor do I see for this? Right? Like who? And basically, even in the ideology of functional medicine, they have to be talking about mitochondrial stuff. Like we have, like, so there's no mitochondrial doctor, right? If
Mm-hmm.
if there was, I would be it, right? Like I would have a
Yeah,
degree in that, like if there
yeah,
was
you
a
would.
certification you could, if there was a certification you could get for that, I would get it, believe me. But there is nothing. So you have to listen to people who talk like we do, who
Mm-hmm.
talk about mitochondria, who talk about the damage to mitochondria, who talk about the lifestyle changes that we do. When the question I get asked is, what are the doctors? It's people who are talking about these things, even though there's no credentials right after your name that says you're the mitochondrial specialist or whatever. That's how you would know. So if the focus isn't there, it's not probably going to be the right fit if you're looking to get the outcomes that Dr. Kevin and I are talking about.
Awesome. Well, I am going to give you a diploma in a doctorate of mitochondria. I'm going to send that to you in the mail. All
I
right.
appreciate it. I definitely
Yeah.
appreciate it.
Thanks, Dr. Rob, and thank you all very much for listening. If you guys want to know more about this, you can check out our website, or if you know someone that has thyroid problems, share this with them. It could save their life. Well, thank you guys so much for joining us, and we will see you next time.